Thank you, Megan. Hello, everybody, and welcome to our third regional report out call here for the North Central region of the state. You can see the map of the regions on our website, covid.ks.gov/report-outs. That's covid.ks.gov/report-outs. You can also sign up for an email there, which will send this call and the dashboard to you every week after it's done, so you can consume it at your own time or share it with anybody that you want. If you have questions or comments that you want us to consider on our next call, please write us at ksregionalreport@gmail.com, ksregionalreport@gmail.com, and just let us know you're talking about the North Central region meeting. And I'm the host, so I'm letting a couple people in here. The last website to share with you here, gogettested.com/Kansas. If you'd like to find a free testing clinic for COVID, gogettested.com/Kansas, a great initiative here of the state. So the way these calls go, I'll read through the dashboard here that our friends at the Kansas Hospital Association have put together for us. It is from December 28th, which is yesterday. And let me pull that up so everybody can see it. All right. So as you can see, and this comes with that email if you go to the website and sign up. For North Central Kansas, there's 14 hospitals in this region, all reported. 43% of the hospitals expecting staffing shortages. We watch that because we know that it's staff, stuff, or space that's creating issues for the hospital, staffing being the main concern right now. And then we come across the next one I like to highlight is on adult staffed ICU bed availability. Again, these are static numbers that live in a dynamic and fluid environment. They change throughout the day. But our point in time here, better news than what we've seen. 61% of the adult staffed ICU beds in this region available as of yesterday. That's 17 of the 28. And so that's good news. We're also, when you come down here, you can see we're talking about this last week, the plateau. We're seeing a number of cases for this region. This is regional data. Dropped last week. Now we really won't know until we push through the holidays if that's going to be a sustained drop or not. I'm going to flip over here to the KDHE website. They have put together, if you get into their dashboards under hospital capacity, there's an HCC positivity rate. So they broke out the regions by positivity. So when we're going to cycle, you're going to get to see me go into this. I don't know why it does this. So when you get to that site, you go to hospital capacity, and then down on the bottom right of the next screen, you'll see the HCC percent positive. And so these are our regions. So when you look at North Central, and you can see the weeks coming down here and the legend that talks about the percent positive. So this is of the people taking tests, what percent are positive, and North Central being the second one down. Just to show something here. So you can see kind of the weekly test, 3,000, 4,200, 3,500-ish, just under 4,000 with a 19% positivity rate. I'm just going through the past few weeks for you. 3,800, 3,600 tests taken. And then this last week, well, that's actually pretty good. So generally the testing had dropped. This is 3,700. That is not an issue with this region. Generally dropped to 2/3 of what it had been. But you can see the positivity rate has gotten better, as well as the case number. So you're seeing 19, 18, 17, and then down to 12.3 last week, and early yet this week with only 57 tests, but 10.5% positivity. So good story and news for the North Central region here with those numbers. And then you can see the counties here in the district. And this is the percent of that population that have tested positive. And I'm guessing Carrie Ann can help us, but I'm guessing Ellsworth is higher because of the prison population there. But this is percent of the population that's tested positive. And then you can see the census of the people in ICU beds, how many are COVID or non-COVID. Oftentimes hospitals are busy this time of year with non-COVID patients near capacity. because of seasonal elements of some of the issues. And we're glad to have some space here. So I read through the dashboard, then we like to go to the experts to provide color. And so we'll kick it over to Carrie Ann, who's in Ellsworth. She had to miss last week's call because they were running vaccinations through there, which is a good thing. But welcome back, Carrie Ann, and can you give us any color from public health side?
Sure. Yes, we are glad to see our numbers are kind of starting to trend down. We hope that trend stays consistent. And you are correct with Ellsworth County, with our prison. They continue to do mass testing about once a week. So those numbers are included in our count. So that's what keeps our number up there a little bit for percentage positivity. But I guess going towards the vaccine side of it, I know most of our health departments in our region did get our COVID vaccines. I know most of the hospitals, our hospital just got it this week. Here in Ellsworth, they're going to start their vaccinations either today or tomorrow. Us here in Ellsworth, I've gotten all of our health department staff vaccinated. We've done majority of our EMS. We're going to open our last vial tomorrow to finish out our EMS and a few other healthcare workers. Couple dentists, those kind of individuals in our community. But other than that, just kind of sitting on the edge of our seat to see what the Christmas, New Year's holiday brings. I know here in Ellsworth, we are going to do another mass drive-through testing mid part of January to kind of see if we can capture some of those positive cases from the holiday. So we had one right before Christmas. We did 4 days of mass testing and we had a really good turnout. And I was glad to see the percent positivity was not near as high as I thought it would be. So not too many surprises came out of that. So it was well taken. I know a lot of health departments have opened up, started doing the free testing through the expanded testing strategy for Kansas. The one we're using is CRL. It's a saliva test that's worked really well for us, and pretty impressed by the speed by which we get the results back. So that's been good to see. So that's, I think, what's going on our end.
And when you talk about the speed being good, how fast is the turnaround right now?
Some days I see it within 24, 48 hours. So
that's huge. That's great. Wonderful. Heather, you want to give some color from the hospital side? Thank you, Carrie Ann.
You bet. Hi, good afternoon. My name is Heather Fuller.
Can you talk just a little louder, Heather? Thank you very much.
I'm with the Sunflower Health Network, and we've got hospitals here in North Central Kansas. Staffing continues to be an issue, as well as staff morale. Transfers has been another big thing this week as well, even with the Mission Control app. I know we have one hospital that reported it still took 5 hours to get a bed, and that was using the app. So you can imagine that could take up somebody's entire day just trying to find a bed for one patient, so that's a huge issue. Hospitals were very excited last week to start getting their doses of the vaccine. Most of our hospitals have gotten those. Some it's gone to the health department, some the hospital. Averaging for our region, the hospitals have gotten around 69 doses or so. So between the low end was 25, the higher up to 200, depending on the size of the hospital, of course. But just one thing to keep in mind is that even though we're getting these vaccines, it's still going to take several weeks, the booster, several weeks after that. And that's still a small percent of folks that are vaccinated. So we still need to continue to wear the mask, social distance, do all of those things that we've been continuing to do for a while to keep everybody safe now. So I think those are the few comments I wanted to share. And I do want to introduce Dr. Dorothy Breaux from Cloud County Health Center, who is going to give us a little bit of a boots on the ground perspective from the hospital in Concordia. So Dr. Breaux.
Hello. Thank you. This week has actually been a little bit better for us in terms of sheer numbers wise with testing as well as our hospitalized patients. I want to say right now we're about the lowest in terms of hospitalized patients that we've been for the past several weeks. We still have quite a few staff out who are COVID positive. I think now over over a third of our total staff members have had COVID-19. It came into kind of a crunch when one of our providers had COVID-19 over the past couple of weeks. She was able to just finally come back today. So then we were scrambling for locums and getting other people to cover our call for ER. In terms of testing wise, of course, we've been down over the past week with the holiday and stuff. So I'm kind of interested to see over the coming couple of weeks how that ends up panning out, with still so many people getting together for Christmas and then catching up on kind of backlogging of tests. In terms of transfer wise, I know our last COVID patient, we ended up having to transfer from here out to Hayes, which is, I don't think, as long as I've been here in the past 7 years, that's not, someplace we typically transfer. We've never transferred to Hayes before. So, and again, it took just a lot of calling around, and the patient ended up having to be flown out to Hayes just because we had no EMS ground transport either. So it's still, transfers remain an issue for us still for COVID patients, but hopefully, I don't know, we'll see what the next couple of weeks brings, but up until, this past week or two have been a little bit better for us. I think that's about all I have.
Thank you, Dr. Bro.
Thank you.
I appreciate it. My dad was born in Concordia. It's a special place in my heart.
Oh, really?
First one in his family born in a hospital. So there you go.
Goodness.
Lots changed since then. So when we're talking about transfers, and we've heard about that, the folks at Cheyenne Mountain Software have the Mission Control app, have been looking at this regionally for us. And Dr. Watson is with us again this week to help us see what's going on in the North Central region. So Dr. Watson.
Yeah, thanks a lot. And the software we use helps facilities find placement as well as then schedule transfer as well. And we have a unique vantage point of looking at numbers that maybe others don't have the ability to see. I'll share with you one of our tools that we use to look at the data, and it involves, we've got this up for the North Central region. And I think it's reflective of what everyone's saying here to some extent. We see that the number of patients are actually decreasing from where they were before that are being transferred, but they're staying relatively sick, acuity index of about 9, which is moderately to more severe illness, with about 45% of the transfers being COVID suspected or COVID positive. Of the ones we deal with, about half of those are asking for placement. Across the board, they wait about an hour and a half to have EMS arrive once a placement is found. But if we look at what that number does, if they need a bed, it goes out to 3 hours is the average wait for finding a bed if needing placement. We know from our bed availability statistics that the system referral hospitals, both primary and secondary referral hospitals, are either at or near at capacity. And we know that that hasn't eased a lot over the last couple of weeks. We're hearing just that there is some potential that is getting better on a local basis, but still seeing at this time that the referring facilities, those that are taking these patients, are at critical capacity. So I think it still bodes well for the region to stay vigilant about what we're doing. We're hearing that there is capacity in the system, but with 90 million people moving in the US over the Christmas holiday, we know the potential for having significant amounts of disease are there. And certainly the first 2 weeks of January will tell us more about what that's going to look like. But for right now, everyone's taking a breath and very hopeful that the first 2 weeks of January won't show an increase. But very glad right now that we are seeing there's a little easing in the disease in that region.
Dr. Watson, when it goes from an hour and a half or an hour and 15 to 3 hours, that's for a COVID patient that needs a bed. Why
Those are just anybody across the board that would need assistance finding a bed. We haven't COVID or non-COVID, it really is about the same. We're seeing that certainly the pocket of COVID ICU beds that's a number that's difficult to crack. And right now it's our most affected resource, knowing that those are at a premium and that the ability to find COVID ICU beds is much more difficult than anything else we're seeing in the system right now.
And so when would someone call you with need help finding a bed versus the hour on their own? Is that when they just kind of look at the app and kind of see and make a call on their own versus having you start making calls for them?
Yeah, almost everyone who has deployed the app is using it to help find beds in one way or another. We get telephone calls, we get entry of requests through the software itself. Any way people connect with us, we're trying to help them find beds as well as find transport. So it's amazing, everybody reaching out. I think we had 80 plus origins that we're working with now. So a good 2/3 of the state in some way or another is accessing the system.
That's great. Thank you, Dr. Watson.
So I've not actually even heard of this software. Is it like a free download, or is there a website or something we go to?
Good point. This is provided by the state of Kansas through KDHE, and we're at CheyenneMountainSoftware.com, and Jesse Thomas, who's also on this, is chief program manager for this and is working with intaking hospitals. Very simple training course that goes through, and then it's a web-based application that you access through a URL and can easily log into and make requests from. But certainly we can reach out to you and put you in contact with the field team that helps onboard hospitals. But we're trying to make contact with every hospital in the state by the end of the year. And certainly anyone out there who has not received information about this, we're more than happy to connect with you and get it in place. Big help in as you know, we've had people that have made 25, 30, 40 calls over a 5, 6, 7 hour period. And it's just a time suck for facilities that are already resource strapped. So happy to step in and be the people that make those calls and find the beds for you all. So.
And Dr. Watson's group is also having a lot of luck with the surrounding states. And so, as you were talking about having to transfer someone to Hayes, we have people from other hospitals being transferred out of state, or to Denver or Lincoln, Nebraska, down in the panhandle of Texas, all wherever we can find those beds as we get more capacity strained. And we're seeing kind of what would be considered abnormal activity for any other time, but it's just the healthcare system doing its best to cope and stretch to handle what the needs are.
Yeah, I think it's amazing. Medicare looks at these, when we submit these claims to CMS regarding movements of patients, and they see these destinations that are totally outside of anything they've seen before. I think there's a struggle to understand that the time is so unusual that we're going to see things in the referral of patients that we've never had to deal with, and it's made the system think about how we view taking care of patients this regionally. So.
All right. Anything anybody would like to add, Carrie Ann or Heather, to the conversation? Jesse, you're out there. Anything? Good.
No, we'll follow up. Appreciate the opportunity to share.
Let me just share a little more information here too. This call again will be every week at 2:30. You can either tune in live or you can sign up for the email at covid.ks.gov/report-outs. Anytime things like this happen, there's people that try and take advantage of it. And so we just have a little announcement to help people stay alert around the vaccine and scams around the vaccine. So 3 bullet points you may want to remember or share with loved ones who you think may be susceptible to things like this. But 3 things to remember. 1, you're never going to be asked for money to enhance your place in line for vaccine eligibility. So no one should be asking you for money to move you up in line. Number 2, government and state officials will not call you to obtain personal information over the phone. So the state or local officials will never call and ask for personal information over the phone in regards to the vaccine. And number 3, you will not be solicited door to door to receive the vaccine. So no one should be coming to your door soliciting for the vaccine. So those are 3 things to remember. No one's going to ask you for money to move up in line. Government state officials will not ask you for personal information over the phone, and no one should be soliciting you door to door on this. So that's 3 good bullet points from our friends at KDHE. Also, our friends at Kansas Chamber just alerting us, and this has been going on for several months, but particularly in the state of Kansas, of unemployment fraud. Just something to be aware of if you own a business or you're employed by a business, which is a lot of people. There's a lot of people trying to take advantage of this opportunity and file for unemployment under your name. So if that's happened to you, contact the Department of Labor and get it straightened out. I've had it filed on me twice, false unemployment claims. So, and I'm still here to talk about it. So I made it through. You can be too. Okay. Bright spots. I got a lot for North Central Kansas. And so since we got a little bit of time here, I'm going to read 3 of them to you. One in Dickinson County. This comes from the Kansas Leadership Center, has a Stop the Spread community meetings deal where they get 1,000 community meetings across the state going. 4-H members in Dickinson County are creating care packages to make sure people on the front lines in healthcare and nursing homes know there are people thinking of them and caring for them as a way to encourage their critical work during the pandemic. So the 4-H members creating care packages for those frontline workers, just to remind them that people care. And I'll tell you, as I've been reading, there's a lot of folks on the front line just really mentally worn out. And so any little acts of love and kindness like this go a long way right now. And our bright spots, again, just as a reminder, catching people doing something right, bringing a little kindness and light into otherwise dark times. And then just a couple from the Healthcare Coalition. So we talk about staff stuff or space. Stuff is still sometimes an issue. It was the primary issue in the March-April timeframe, but it usually comes down to around sizes of things. So there may be a lot of masks in the cupboard, but they may not be the one that fits everybody, right? So Saline Regional was in desperate need of size small N95 masks. While the Regional Healthcare Coalition Cash had plenty of universal sizes to offer, this was not preferred as staff had not been fit tested on this particular model of mask. A call went out to see if another hospital could trade for the requested size, and almost immediately Jesse Walker from Ottawa County Health Center responded, and the North Central Kansas Readiness and Response Coordinator retrieved the cache of the needed masks and transported them and was able to deliver them to Salina Regional. So that's just a great story. Someone stepping in, moving things around. That we do have caches and just Salina the healthcare system doing a good job talking to each other. Again, the Wilson Care and Rehab Center's order of isolation gowns was somehow not received on time, and the center was literally completely out of gowns. Administrator Lee Arnett contacted the North Central Kansas Readiness and Response Coordinator, who then met the staff at one of the regional cache location sites with enough gowns to get them through until their order arrived. So just love seeing Kansans step in to the middle of this and help each other out, and people asking for help. So thank you everybody for your time here, Carrie Ann and Heather, Dr. Bro, Dr. Watson, Jesse, for the time today. And we'll be back here next week. We'll be here, I guess, next year at the same time. So happy holidays, and we'll see you next Tuesday at 2:30. Have a great new year.
Thank you.